Hello, I am Dr. Shiti Bose, a dermatologist and a cosmetic surgeon from the Department of Dermatology in City Hospital. I am here to talk a little about skincare routines that we should usually follow in our daily life. So, coming to each of it, the skin is the largest organ in the body. It's about 2 meters square of body surface area, but it is one of the most neglected, I would feel, amongst all of us. We tend to neglect our skin quite often in our daily routines. So over here I'll talk in short about few things, basic necessary things that we should be doing in order to protect our skin and keep it damage free. So first of all, first and foremost, the most important is daily moisturizing of the skin. That is, a daily hydration of the skin is highly essential to maintain a young looking youthful skin which is damage free. So it's highly important to put a daily moisturizer routinely, or other than this, also important to take a good amount of water. That is about 2 to 3 liters of fluid intake, which can be in the form of water or in the form of fruit juices as well. Other than this, about 2 to 3 servings of fruits daily would be highly beneficial. Secondly, is most important, which most of us do not do, is sun protection. Application of sunscreens is highly essential. Why? Because if we do not apply, it can lead to early aging of the skin, in the form of wrinkles, in the form of blemishes, in the form of a lot of other like tanning can also be part of skin damage due to sun. So it is highly essential that we apply sunscreens, which should be applied ideally 20 minutes before we leave out or go out for work, or we go out of the house, and it should be applied at least 2 to 3 times a day. That is every 3 to 4 hours at least. After this, coming to the next, that is third point that I would like to stress on, is daily cleansing of the skin. Twice a day cleansing of the skin is highly beneficial, and it should be done at least twice a day in the form of any form of face washes or face cleansers. It is preferably better to avoid using soap that we normally use for the rest of our body, because the pH of the soap is quite different. It is very alkaline, and it tends to make the skin very dry, and it also tends to make the skin look haggard. So it's highly essential that we use a proper pH balanced face wash. It can be, for oily skin, the face washes used can have salicylic acid, whereas for dry skin we can use glycerine based face washes. Coming to the next point, certain essential vitamins for the skin, like vitamin E and vitamin C, can be taken once in a while, and it helps in maintaining the youthfulness of the skin. Also very important, which most of us do in our daily routine life, is taking over the counter medications and over the counter or self medication for any sort of skin problems. Like it can be maybe fungal infection. Certain people take it for glow on the face, or certain people take it for bringing a little bit of fairness. Most of these OTC products, that is over the counter products, do contain a high amount of steroids, which can harm the skin. So a long term use of steroid, especially on the face, can lead to thinning of the skin. It can lead to appearance of pigmented spots or hypopigmentation of the skin, and it can also lead to increased sun sensitivity. So it is very essential that we do not self-medicate or take over the counter medications. So whenever, especially if there are any conditions involving the face or any doubts regarding skin of, especially of the face, it is important to visit a dermatologist. So for if you really need the radiance or the glow, there are many sort of procedures that can be done, like peeling, chemical peeling, which would really help in bringing some amount of radiance to the skin. So the next time, visit a dermatologist for any sort of skin conditions, especially pertaining to the face, because face is, after all, highly essential. A good skin, a healthy skin, improves the self-confidence, and a bad, unhealthy skin definitely shatters one's self-confidence. So thank you.